Recommendation of NHI in terms of its model, the phases, and the management of each phase is critical. This is why we as Board of Healthcare Funders, representing the medical schemes, managed care organization, and medical scheme administrators, we are saying we can come to the party and support government when it comes to that activity. The aim being that when it is launched and implemented, let us not make obvious mistakes. Let's not embark on pathways which we know already will not lead to the appropriate implementation of this, and therefore sustainable and then attracting a lot of risks. Let us, as people who are operating in the industry already, dirty our hands, roll up our sleeves, and work with government, making sure that this gets off the ground well, guided by government. In terms of that, our expertise, our systems, our resources, let's make them available. Not claiming to have an answer for every problem or every eventuality, but at least we've got something that we can put onto the table.
In terms of medical aid schemes, what are the primary building blocks that need to be addressed at this stage? The
building blocks speaks to how you pull the healthcare financing. The problem with the current medical scheme industry model is that there's a lot of fragmentation. The healthcare finances that are there in the private sector are in fragmented pools. And also the 8.2 million lives that are pocketed in these medical schemes are in fragmented pools. Now, because of that fragmentation, you lose out on scale. And you therefore also are not in a position to negotiate with providers and attract the most reasonable tariff for those services. So that's why at times in the industry right now you also see medical schemes consolidating, because they're consolidating, trying to mitigate the fragmentation so they can have some kind of scale that they will then use to negotiate. So the key thing around NHI, the way we understand it, and not a lot of people are talking against that, is that the advantage of NHI is that you'll pool the healthcare financing, you'll pool you then pool all the people who are going to be part of that system. You'll put them into a single pool, and when you put those people into a single pool, you benefit from the cross subsidies. You also benefit in terms of the financial cross subsidies. If you have a huge pool of people, then we have those who are sick and are high claimers, and those who are not so sick and don't claim very high, but they're making contribution. Therefore, you cross-subsidize that. And then secondly, you have the money in the pool that will then use to negotiate and extract the best price.
How does corporate South Africa need to respond to NHI and be aligning itself as we move into an era of NHI?
Corporate South Africa, from the employer side, will have to apply their minds to what it is that they would insist on for their own employees, should their employees be part of the NHI process. Because the employer's main interest is that my employees are healthy, and when they're sick, they access health care. So they have to insist on that. In terms of the medical aid scheme industry, the medical aid schemes and the medical scheme administrators, they need to apply their minds to how they package themselves and structure themselves in such a way that they become a template, if you will, that will be used to implement this NHI. Must remember, the NHI is going to be meted out to 49 million lives. The current system is only servicing 8.2 million lives. So if you position the current system in such a way that it's a template that you build on to cover then the 49 million lives, then everybody who's operative in the system now is part of the process and nobody is left out. And I guess that's where the win-win is, that everybody who is actively involved in the system now, if we become one of the templates of establishing NHI going forward, you are then not left out. You're part of the process, and you're working with government going forward. The risk is to position yourself not to be part of it, and then you maybe lose out as time goes on.